Hi, Jamie Davis from the Nursing Show here at the ANIA conference in Philadelphia, and we're talking nurse informatics, and actually we're going to be talking about how that affects patient engagement. I'm here with Jane Sarasohn Kahn, and Jane, before we get started, why don't you tell us a little bit about your background as a nurse and what you're doing here?
Well, actually, I'm not a nurse at all. I'm a health economist.
Oh, excellent.
So I think about how resources come into the health system and how they get deployed, and nurses play a huge role in determining how resources get used.
So what is a nurse economist doing talking about patient engagement?
Well, a health economist is keen on patient engagement because we can achieve what's called the triple aim: reduce costs, enhance health care, and drive outcomes without engaging people in their own care, in shared decision making, and in adhering to medical instructions. So we economists love that, and we know patient engagement is the secret and the sauce to getting there.
So how is that changing right now? Because I know it's changing as things adapt.
Yeah, a couple things are conspiring and converging to help people engage more in health. One is just we're all doing more ourselves. In the DIY movement, we're using OpenTable to do reservations for restaurants. Mm-hmm. We're managing finances online. We're doing more at home, cooking more at home, and using apps and tools, iPhones, iPads, tablets. We're looking for that convenience and engagement in our health now. So there are more and more platforms to do that, certainly mobile health apps, patient portals from electronic health records. The more patients and people use that, the more they can engage in health and really move the needle on healthcare and their costs.
So how do healthcare providers adapt to this?
Yeah, well, the low-hanging fruit there is, of course, doing your meaningful use for EHR implementation, but that is not everything. That's just a little piece of it. Doctors and providers who are taking on more value-based payment need to engage patients in care to keep people out of the health system so they can collect bonuses at the end of the day, but more importantly, achieve better outcomes and HCAP scores on which doctors and clinicians are increasingly reimbursed. So patient engagement pays in all kinds of ways.
So let's look into the future a little bit. 10 years down the road, where do you see this as it's changing so much now? Where do you see it going in 10 years?
I think within a decade, we're going to be doing most of our care at home. We'll be doing telehealth through Skype type virtual visits, more and more visits on the phone, like through American Well, which already has a phone app. Walgreens is doing appification of healthcare through the Walgreens app for everything from getting access to the Merck manual, and you can develop your photos at the same time, but also manage diabetes through a WebMD app in Walgreens. So there's a ton of things people are already doing, but 10 years from now, the home will be the hub of health.
Well, Jane, thanks a lot. I know there's a lot more we could talk about on this, but we're trying to keep these segments short.
Great.
So thanks a lot for being on the Nursing Show.
Thank you. My pleasure.
And I want to thank all of you for checking this out. We'll have more from ANIA here, so check out more of these segments on this channel coming up soon.